Hey, folks, welcome back to the show. We have a great episode for you today. My guest today is an expert in the science of mitochondrial activation, and he's sharing insights on the supplement that you need in your longevity routine. And that's been a part of my routine since the first episode I recorded with him over a year ago. I'm joined today by, again, Dr. Anurag Singh, who is the Chief Medical Officer at Timeline Nutrition. We're diving into the realm of mitochondrial activation and its impact on muscle performance, as well as new research on its impact on your health. We shed light on the role of immunity in a healthy long life, focusing on how mitochondrial health can rev up our immune systems and where urolithin A, the active ingredient in MitoPure, comes into play. Dr. Singh also shares his insights on how mitochondrial health can influence, wait for it, skin health and reverse sun damage, and the development of topical formulas that can improve mitochondrial health in the skin. This episode is packed with value. So, Timeline Nutrition is offering 10% off any order of MitoPure. Just go to timelinenutrition.com/nat10 and use code nat10 to get 10% off your order. To learn more about Timeline Nutrition, just go to timelinenutrition.com. And to get more, to dig into the science of MitoPure, go to mitopure.com. Now, before we jump into the episode, I do want to take a moment to thank you guys for being here in the first place, to thank you for all the comments and questions that you send to me. I love all of them, and I do my best to respond to every one of you. People are reaching out to me through Instagram, through my Facebook group on optimizing superhuman performance, and of course, those who want more of me and more of an intimate connection, let's say, will join my Mighty Networks community called the BSP community. If you want to learn about BSP private membership community, just go to natnidham.com and look for the tab at the top called BSP community. Also on my website, you can learn about my upcoming Women's Longevity and Resilience Retreat in the Dominican Republic this November 1st to 6th. If you have any interest in that retreat at all, make sure to check it out on my website and book a free call with me and my co-host, Dasha Maximov, to get your questions answered. So thank you again for being here. If you're loving the episode and you know someone that would benefit from it, please make sure to share it. If you're feeling inspired, please, please, please leave us a review, because that's how we rise up the ranks. And that is ultimately how I'm able to get even more amazing guests for you guys. And now let's jump in. Hey, folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Dr. Singh, welcome back to the podcast. It is such a pleasure to see you today.
Thanks for having me, Natalie.
Yeah, well, this is going to be a great conversation. I mean, they always are. Our first podcast together, I remember, kind of going, oh yeah, MitoPure, pomegranate, urolithin A. By the end of the hour, I was like, get out of town. Mm-hmm. So I think we've got another big episode. You've got some great new research that's coming out and that you're working on, and makes, it's no big surprise, mitochondria being the star of the show here, and having found a compound that can positively impact mitochondria, it's going to have wide-ranging benefits. But I think maybe a good place to start for people who are not familiar with the subject matter and who didn't get a chance to listen to the first episode. Although, guys, I do recommend you listen to the first one, because we're not going to go as deep into the background as we did that first time. But maybe, Dr. Singh, you could give us a quick recap on the mitochondria and how urolithin A came to be, and how it helps.
Sure. I'll start with mitochondria. So mitochondria are these cellular organelles that are basically the energy factories, right? So think of the engine in your car that basically keeps your car moving, and that's what mitochondria are doing for us. So every time you get up a chair and walk, or you feel fatigue after a run, that's your mitochondrial health that is basically dictating that. And it's one of the key hallmarks of aging. So as we age, basically these cellular organelles, they accumulate stress signals in what we call as oxidative stress and reactive oxygen species. And with time, basically their repair machinery slows down as well. So now instead of having a good pool of healthy mitochondria always giving you the currency of energy, which is ATP, you have a more faulty mitochondria, and so you need ways in sort of through your diet and nutrition to improve your mitochondrial health. And so we applied the biotech approach to basically screening hundreds and thousands of nutrition and natural compounds to really see which one of them potent at improving mitochondrial health. And we came across one particular compound that was actually not found in foods. It's the precursors of which are found in, well, every healthy known fruit and to mankind, like pomegranates, berries, and walnuts. And so these are precursors called polyphenols. Mm-hmm. And so if you're taking it, your gut microbiome will take these complex compounds and release this molecule called urolithin A. And that's the molecule we stumbled upon. The unfortunate part is that not all of us have the right gut microbiome, and neither all of us are eating a bowl of nuts and a glass of juice every day. So that's how we came to urolithin A.
Yeah.
And so from there, all the research has emerged.
Yeah. Well, and I would say that very few of us are drinking that juice. I mean, the last time I had a glass of pomegranate juice before I did the trial that you used to offer a test. Yes, where you would drink pomegranate juice and then see how much of it you're able to convert into urolithin A. And of course, my numbers were dismal. But the last time I drank a glass of pomegranate juice, I was in Jordan. And there was a man sitting in a chair squeezing pomegranates. And then it was delicious, but it was probably more sugar than I'd consumed in like the last month. So just drinking the juice, unfortunately, quite apart from having low conversion rates. And I would argue most of us don't have an optimal microbiome at this stage of the game. It comes with a lot of sugar. So being able to get gifted the end product is a beautiful thing.
Yeah, and that's basically what we found. We ran trials around the world, in the US, Canada, France. The French are probably eating the good balanced diet, closer to the Mediterranean diet that we hear of. We saw about 30% adult healthy population could convert or had actually circulating levels of this molecule. In the US and Canada, it was more like 10, 12%. So even if they had these, the levels were so low that you won't really get what we call as the health benefits from those levels. And so you were correct that, what we figured out was that we could short circuit this sort of natural conversion and the imprecise and natural conversion and give calibrated supplementation. And that's how we came about urolithin A.
Beautiful. Okay. So, and one of the many things I love about your company is the focus on human research. I mean, everybody's running around with a lot of research on cute little critters with, long tails, little whiskers and cute ears. But not that many companies make the leap in the investment into human research. But so let's talk a little bit about what does urolithin A do exactly for mitochondria?
Yeah. So there are a number of ways in which you can improve mitochondrial health. All right. So you have your healthy pool of mitochondria, so you can grow that pool. And that's what in the field we call as biogenesis. So that means you're just growing newer mitochondria, younger, healthier mitochondria. And then the second way in which you can improve mitochondrial health is you take your current pool of healthy mitochondria and you get them working more efficiently so that now they're producing more energy. And there are various nutrients that do both biogenesis and sort of make mitochondria more efficient. There are things like NAD boosters for biogenesis. There are things like CoQ10 and L-carnitine to make your mitochondria more efficient. But mitochondria are always in a flux between sort of the good and the bad mitochondria. And there's always what we call as a sort of a very delicate balance. Now, what happens if you get injured or with aging or with sort of being overweight or stressed is that your poor faulty mitochondria get higher in number inside your cell. And so unless you clean that waste or the poor mitochondria, you're not going to have an optimal sort of energy state. And that's what we found urolithin A does, is that it activates this very well conserved process we call as mitophagy, which really means as eating up. It's like an autophagy, but autophagy of the mitochondria, which means now you take these crummy, faulty mitochondria and put them in a garbage bin, and now they become sort of building blocks of newer healthy mitochondria. So it's basically like think of your garbage disposal machinery in your house, right? If you're not cleaning out your waste, your house is not going to smell right. So what we saw basically when we discovered this compound, you pointed out a lot of people just don't do the hard clinical research. We actually ran a number of randomized clinical trials over a good part of 7-8 years in different populations, in older adults where you expect mitochondria to be declining, in overweight middle-aged 50-year-olds who are all sort of healthy but on the fast trajectory towards sarcopenia and frailty down in their 70s and 80s. And what we saw was that just by activating mitophagy, you would get these really profound benefits on muscle performance. So these people, in the absence of exercise or even a change in the diet, were experiencing better leg strength, muscle strength, and some of the older adults had higher resistance to fatigue, which meant they could just go about doing their daily activities 20% longer. Yeah. And so that's some of the research that led us to launching the products eventually.
Yeah. And we'll talk about the products at the end, because you have such great options in these products. There's literally no excuse not to use them. Aside from the investment, but at the same time, if you can go down to a cellular level and affect your energy from the very place that your energy comes from, I think it should be a very easy equation in the brain. And what I think, we were talking about before the podcast, you started with research in muscle, probably because, first of all, muscle is very, very densely populated by mitochondria, but it's also easier to show a benefit, right? Like you were supplementing, you were helping people to supplement with MitoPure for a period of time, and then you can measure their exercise output before MitoPure and after. But as we were talking about before the episode, and this is really where your research is going, which is so exciting, is there are the other parts of the body that are filled with mitochondria, being the heart for cardiovascular health, the brain for cognitive health. Like it's, I've always said, and I remember thinking, okay, so MitoPure muscles, that's really great, but does it actually select mitochondria in the muscles, or is it affecting the mitochondria in the whole body? And as it turns out, it's just a process of how much research can you do at one time, so that you can look at different systems.
No, 200% correct. We started with muscles because in clinical setting, it's much easier to tease out the signal of efficacy. Just from a sort of a historical perspective, the company initially had focused on sort of focusing on brain health. But, I think when we started to see all these trials in sort of even neurodegeneration and stuff, the endpoints are very tough to tease out, and how you go about selecting. So the muscle is, as you said, is clearly the most metabolic organ that we have. It's the highest producer of the energy currency ATP, but it's also the highest consumer of ATP, because we just, the moment you get up from a chair, you're consuming energy. The moment you climb stairs, you're consuming energy, right? So we went after that because basically there are a number of readouts, there are a number of clinical research tools available. You put people on a cycle ergometer or a treadmill, or you make them run a race, or you do a walk test. So there's so many tools to look at the efficacy. And so that's one of the reasons why we started with the muscle space. And it's such a key longevity organ that impacts our health span and how we behave when we are 70 and 80.
For sure. And the other cool thing about your research and what's come out of it, and we're going to talk about it in some of these new studies you have coming out, is that you're looking at the elite athlete, but you're also looking at the aged population. Like you're looking at both ends of the spectrum, right? You're looking at your elite performers. Can this be helpful for them? And at the same time, you're also looking at, a healthy person who might have had a car accident and is bedbound, or an elderly person, as you were talking about earlier. I mean, one of the big things for elderly people is keeping them moving so that they can maintain their lean mass, never mind their quality of life. And so you have something here that addresses every one of those populations in its own way, which I think is it's super exciting, right? So the good news is this podcast comes out at the end of June. You have new results that are coming out next week. So we get to talk about them during the recording and not steal anybody's thunder. So maybe we want to talk about that. This is the elite athlete and overtraining study, right?
Yeah. So we have two published studies that randomized trials, one in older adults, as I mentioned, and the second one in 50-year-old sort of healthy but sedentary population, both showing impacts on muscle performance. And then the question was, well, would this work in an elite population of individuals, athletic individuals, which presumably are in the peak of the muscle performance, right? So if this was a curve of muscle health as you decline, the elites are right up there, even if, maybe probably at the peak of human performance. And we would have not thought about it until one of the leading researchers read our initial work and came to us saying, well, I think a lot of these elite athletes are inflamed and the mitochondria, because if they train so much, the overtraining impacts mitochondrial dysfunction. And so we said, and she actually published with a group this work in a very high impact journal. And we said, well, do we want to try it in these elite? So we went after, and there's certain challenges with working with elite athletes, as you can imagine. If you say, compared to a 50-year-old, I want a piece of your muscle to study it.
You're not getting a piece of my muscle.
You're like, oh, we have Olympics coming in 2 months. You're not going to get it. And then we did this during the peak of COVID between 2021. So it took a while to try and convince, but this was a beautifully designed study. It was actually done in Australia with one of the leading sports researchers, spent 4 decades studying how elite athletes respond to different nutrients and diets. And it's Professor Louise Burke in the Australian Institute of Sport. And she basically proposed a study in elite middle distance runners, where some of them were even training for Olympics last year. And the whole idea was to bring them at a pre-training camp, give them all the same exercise training conditions, give them there was actually a chef that went through the whole month with the set of elite athletes. They all ate the same thing. They all did the same exercise training. And then one group got a placebo, one group got a MitoPure of 1,000 milligrams. And the goal was, over time as they train, it's known that their body adapts. So, just imagine their VO2 max, which is basically an indicator of aerobic capacity. These guys are at 65 VO2 max. Now, this is almost at an insane level of VO2 aerobic capacity. And by the end, they expect to have a 1%, 2% benefit, which basically is the difference between somebody coming last in a 1,500 meter race in Olympics versus winning the gold. That 1% is absolutely key for them. And so we did this study, and the second main goal was recovery. Their muscles get damaged, they become inflamed, and so the whole idea was, could we see a benefit there? And so what we see basically, and this is really top-line data, so we have to dig a bit more into the data, is there's a profound benefit of MitoPure intake on recovery. So the muscle is looking less inflamed. So things like C-reactive protein, which we have also observed in other trials, we see in elite athletes that it's down by significantly down by almost 20-30% in these athletes.
Wow.
And then there's a marker of muscle damage called creatine kinase. This is whenever muscle gets damaged, whether it's the hard muscle or the skeletal muscle, creatine kinase will just peak in your blood, and you can measure that. And so we saw even a similar magnitude effect on lowering creatine kinase, meaning the muscle is less damaged with MitoPure supplementation. And then what most of these athletes do, whether it's running or cycling or soccer or basketball, is there's a very standardized questionnaire given called ratings of perceived exertion. So we gave that to these athletes. It's called the RP score, and it's a rating of about from 6 to 20, and 20 being the most severe exertion they felt. These athletes in MitoPure compared to placebo, we saw that they felt less exertion after an intense high training race, like an Olympic competition. So all these pointers are towards mitochondria being absolutely key in recovery in elite performance. And so on the performance side, we are seeing these gains of 1%, 2%, but it's really the recovery that is having a big impact.
Yeah. And I would imagine over time, you might even see things like less propensity for injury, because if you're not as inflamed, if you're recovering better, if your mitochondria are working better, maybe, you're less fatigued. You just might be less likely to sustain an injury. I mean, we're starting to stretch a little further, but if we think about the logical downstream effects of reduced inflammation and improved recovery, it's going to be all that and being able to train harder so that you get better results down the road.
Yeah. And so that's another trial we are currently doing, is looking at the injured sort of young athlete who gets injured. The way we do it is a bit of a intense clinical trial setting where we put a knee brace on these young athletic people. And now it's like a cast that is put if you get a fracture, right? So you put this on for 3 weeks, and that induces mitochondrial decline and muscle wasting. And so we are starting to study that. But I agree with you. I think this would work great for this sort of injury prone, aging athlete, or just any athlete that has a propensity to not recover well.
Yeah. And also, I mean, if we look at the athlete population, but then we look at Joe Blow down the street, whether it's your weekend warrior or someone who just doesn't get to the gym enough,
Yeah.
even a sedentary person, ultimately those senescent mitochondria, I mean, I imagine we're getting rid of senescent mitochondria,
Mm-hmm.
which are, sitting there being, I think it's Dr. Kaufman, who calls them grumpy old men. They just sit
Mm-hmm.
there, they don't really do their job. They grump on everybody else. They convince other people to be grumpy. Like it's this expanding circle of negativity.
Yeah.
But in your sedentary population, if you can kind of clean that out and replace it with better mitochondria, maybe we can help them to feel a bit better so that they move a bit more. And it's one of the things that I love about MitoPure as a molecule, and I'm sure that's part of why your research is so wide ranging, is that it has applications in every single population. And
Mm-hmm.
so now and I know you've got other studies coming down the pipes. You've got one in a hospital setting. So again, you've got someone who's injured, they're recovering, they can't move, and that'll come down the pipes down the road. So I don't think we need to talk about that too much, but I really want to move over to another area of focus, which is so important and pertinent, particularly when it comes to aging and living
Mm-hmm.
well, and that's immune health. And so maybe
Sure.
let's talk a little bit about how does MitoPure or even mitochondria come into play when
Sure.
immune health?
Yeah, I mean, I think post-COVID, we are all now more aware of the role of immune health, in sort of leading a healthy and long life. And so immune cells, much like your muscle cells or brain cells or your heart cells, have a lot of mitochondria. They have a very high metabolic demand too, and they rely and you have the immune system is basically a two-prong defense mechanism, right? One is what we call innate immunity. So this is when you get injured or when you sort of first see a virus or bacteria, the first sort of defense mechanism, that's innate immunity. And then there's what we call adaptive immunity. This is what we call as T cells and B cells that basically learn and adapt over time to fight infections and basically make your immune system strong. So what we're seeing basically come out, and we had already some evidence from our trials showing that we were having an effect on inflammation per se, but now there's more research coming out that as we age, there's a certain pool of immune cells that we call as stem cell memory cells. So these are
Mm.
sort of these young, youthful immune cells that are always hiding and leading to sort of newer immune cells that fight infections, and that populations declines with aging. So these sort of superhero, supercharged T cells that we call as stem cell memory cells, they kind of decline, and that's why when you're in your 60s, none of the vaccines don't work, right? So you go and get your flu shot or even now a COVID shot, you get a 15% response. And so how can you rev up these memory immune cells is the absolute key. And fascinating, our collaborators showed that basically the defect lies that mitophagy slows down in these memory
Hmm.
T cells. And when mitophagy declines, your immune system becomes weak. It can fight off infections. It can fight off cancer. And so what they did was, this is a group we worked where a lot of big immune discoveries were made in Germany. They supplemented in different settings with urolithin A, and they found that urolithin A or MitoPure basically revved up these supercharged memory T cells
Wow.
to an amazing potential. And now they just revved up the whole immune system at a sort of a cascade response. And that led to clearance of cancer, clearance of better immune responses. And so now we are running a lot of trials, but now on immune system.
That is so exciting, right? I mean, and was that, it's, I mean, on the one hand, as you're saying it, it's like, no kidding, right? I mean, if we're going to improve mitochondria in the whole system, it should affect mitochondria in the immune system. But how incredible that you're able to show that you basically upregulate immune function by supporting mitochondria, like as far upstream as you can possibly go. Like that's super exciting. So so basically now you're saying you have new studies coming down the pipes in humans studying
Yeah.
mitopure, like mitochondrial health and immune function.
Yeah, so we have two studies. One, we are working in just the average healthy Joe, right? Like you and me, like what is the effect on the immune system if you're on mitopure for a certain amount of time? And so we have actually started one of the biggest projects in the field of immune health, and this is with the Buck Institute of Aging. Eric Verdun there is on the project. We have the German group that I was mentioning of Professor Gretten, and we are basically looking at every single immune population and how their mitochondrial health changes over time on mitopure. And so if your mitochondria are happy in your immune cells, your immune system will be happy. And that's really the kind of message and results that we want to get out of this study. The second study is more relevant to, for example, folks who have just beat cancer, for example. This is the post cancer population. A lot of people, when they're diagnosed with cancer, they're given what we call as chemoradiotherapy, which is basically neoadjuvant therapy, and that kills not only the cancer cells, but it also kills some of the healthy, well, actually a lot of the healthy immune cells as well. And so the hope is that by giving mitopure in this population that has just beat cancer, you can rev up these memory-like immune cells, and now they just receive the immune system better because that a big population of cancer patients who beat cancer, they suffer from infections down the road, relapse of the cancer. And so the idea is that modulating the mitochondria there would help. And so we've just won a big $1 million grant to work with one of the top oncologists here.
That's amazing. That's fantastic. So in the study, in the work that you've done so far on immunity, how long are people using the product? Like how long is it taking before you're starting to see the benefit? And is it at the 500 milligram dose or is that the 1 gram dose a day?
Yeah, so well, we actually asked the same question you asked as well. Mitochondria are not just in the muscle. So we had done these studies earlier on that we published in Muscle, but we had banked the immune cells. So we had actually, taking
so
muscle
you had some
biopsies.
data. Nice.
So we already had the immune cells is just a simple blood draw versus taking a biopsy and studying the muscle signature of how mitochondria. So we went back and we actually asked the same question. What's happening at the same time in muscle? What's happening in the immune cells mitochondria? And this was the study we had published before in the 60, 70-year-olds. And we looked at and we saw the exact same signature that we were seeing in muscle of mitochondrial health. So we saw improved energy pathways, we saw improved immune health pathways. And so it was really a deja vu moment. We were like, okay, we focused so long on muscle, but there are mitochondria that are getting affected all over. And the thing with immune cells is much easier to run trials because you just bleed a few times and you study the immune system. So it makes somebody like me, a trialist, for the job very easy. So it takes about a month to start seeing the same biological signature that we see at muscle. Okay. And I think in a couple of months you have a very robust immune system. So we're actually working on an immune health boosting product now.
That's amazing. And so, some of your studies, you're using 1 gram of mitopure, of urolithin A, which is about double the daily dose that you're delivering in most of your products. But does that at 500 milligrams, which is the typical dose that people would use, is it just going to take a little bit longer to see the benefits, do you think?
Yeah.
Is it a point of time?
Yeah. Sorry, I didn't answer that before, but yes. Okay. So 500 milligram is where we start seeing the signature at the mitochondrial level, and in about a month's time, and in 2 months we start seeing the benefits on the muscle. That's the published work we have. the gram dose, we start seeing benefits a bit earlier and a bit more
Okay.
robust. Okay,
Okay.
so it really boils down to where you think how fit you are, or that's why we started offering even the test, sort of, because if you already is producing little bits from your diet with urolithin A, 500 makes more sense to be on for a longer time. If your body, personally, I can share that my body never. I've tested myself a number of times. I eat well, but my body refuses to make urolithin A. So I always take a gram,
Yeah.
and then if you feel fit, then you can always taper down also to 500 milligram eventually. But the immune effect is very robust at a gram.
At a gram. Yeah. So
Yeah, we see.
you could imagine people saying, okay, well, flu season is coming. I'm going to up my dose. And now it's summertime. I'm eating more fruit. I'm outside more, blah, blah, blah. I might taper down to 500 milligrams for a while and then bump it up again. Like you could basically play with your dose, or if you're going through a heavy training period, ramp up your
Yeah,
dose during that heavy training period. You're in more of a recovery. So it allows people the ability to kind of ebb and flow with their dosage.
I totally agree. I mean, think of this as vitamin C of aging, right? I mean, a lot
Yeah.
of people take about a gram of vitamin C without really knowing how much of it is absorbed or how much your body really needs it. We just take it because
Yep.
we it's in our sort of psychology that vitamin C is good for your immune system, or even zinc, for example, is good for your immune system. And so here we have a clear mechanism of action, which is by revving up your immune cells metabolism and mitochondrial health, and now they have more energy to sort of turbocharge and fight infection. So, and the dose we are testing is basically a gram in a lot of these trials, because that's where we have seen a very robust immune health signature.
Well, and you're also going to see results faster, right? So in a trial, time is not on your side. You need to, you don't
Yeah,
have time to sit there for a year and wait for things to
you got
show up. Um,
exactly.
and I think the other area of research that's going to be very interesting that you talked about, which makes a lot of sense. I mean, where do we see the biggest concentration of mitochondria? Skeletal muscle, the first place you started, which was the most obvious, but then the heart muscle, and then the brain, right?
Yeah.
And then in cognitive health, like, you have trials coming down the pipes there, and that's going to be so exciting. And obviously, hopefully you don't have to biopsy people's brains.
No, no, no. And yeah, so we are again a small company that has this very deep rooted in science, but you can only go one benefit after another
For sure.
research is two words, re and search. So you always have to get back to the drawing board and say, okay, we've proven the effect on muscles. Where's, as you said, where's more mitochondria? Heart. Let's look at the heart. And then now that people are reading the promise of this molecule, a lot of them are doing their own studies. We had actually multiple groups reach out to us saying, well, we've been starting to look at cognitive decline with aging, and in sort of looking at cells from older adults who have this cognitive decline, we are seeing that mitochondria are greatly compromised.
Mm-hmm.
And we have run a whole series of tests, and we think your molecule has a lot of promise because, and actually the group at National Institute of Aging published that in a lot of Alzheimer's and other sort of neurodegenerative conditions, mitophagy was the core reason why they were seeing this neurocognitive decline. And so I think that you'll start to see neuro trials or brain trials take a long time. You need
Yeah.
to look at a year or 2 years even, and then you need to bring a lot of imaging modalities, not biopsies, but you need to rely on things like PET scan and a lot of questionnaires looking at people's memory, recall, and attention span. So that's an area of research we are kind of relying on partnering with
Yeah.
really the top gurus rather than trying to do the heavy lifting ourselves. On the heart, we have some very promising data, not clinical yet. So we are planning to do the clinical translation, but at the preclinical level, we've been working with the University of Washington, and we've been bringing what we call as really a visual way to look at mitochondrial health. And this you can do by looking at the heart of these older animals through something called as electron microscopy. You can really nail down to single individual mitochondria. And when you look at the mitochondria of the old animals, what you see is basically a whole circuitry that looks like basically a sunken mesh. So it's like you have wires around that kind of dictate the energy transfer inside of mitochondria. That whole network is collapsed in the old mitochondria in the heart. And when you are in MitoPure, when we put these same sort of in an experimental condition on MitoPure, these mitochondria starts looking like as if they were younger hearts.
Wow. Wow. Wow.
We are very excited about this research. Of course, having said that, as you said, it's in these fuzzy, hairy animals at stage, but we do think that's a lot of promise to translate it into humans, and we're going to do that.
Yeah, no, that's incredible. All right. So as we're slowly winding down, we have two more topics we're going to cover. Yeah. And one of them is, hey, we don't only want to like function well, but we also kind of want to look good. And so if we go to the Timeline Nutrition website, there's now skincare. And so talk to us a little bit about how MitoPure might affect skincare and how you're delivering it, because you've got serums and creams and the whole 9 yards. What made you go there, and what are you seeing? And tell us a little bit about that, because, looking good kind of helps. Nobody wants to finish kicking ass looking like a raisin.
No, great points. So there were two reasons we went there. One, we are a longevity company, and every time I started showing the data, people would say, "Well, what would I feel? What would I feel? After taking a product?" I was like, "Well, you'll feel more energy, you'll feel less fatigue. But how do I see it? How do I know?" And that actually seeded the idea in the head of a lot of our scientific team and clinical team that, hey, what would people see as a consequence of aging? The first thing they wake up in the morning or before well, it's your skin health, right? Everybody looks up in the mirror and sees the impact of father time there on their faces. And so we said, okay, well, let's look at the mitochondrial health in the skin. And we started studying skin samples from younger versus older donors. And we saw that the mitochondria was actually very key. Skin cells have also a lot of mitochondria. Sure. And from the 20s, 30s, where skin is looking at probably at its peak, to the 60s and 70s, there's a drastic change in the energy supply of the skin that results in sort of wrinkly, dry-looking skin that we all associate aging with. And that led to a lot of work and a lot of trials trying to show. So the way we figured out that, well, orally probably you're getting some benefits, but almost not all of it is going to make its way from oral absorption to the skin. And so we delivered very calibrated topical. We developed topical formulations. So we developed day creams, night creams, and serum that all have 1% of MitoPure in it. And they all have other goodies like niacinamide and other good stuff that also help skin health. And we ran a number of randomized trials that we are about to publish. And we see great effects on sort of reducing wrinkles, boosting collagen, and really fighting skin inflammation, which every day as we step out in the sun, our skin is getting inflamed.
Yeah, no, that's fascinating. One of the things you mentioned before we started recording was showing that your skin products actually help to reverse some of the damage that we sustain on a day-to-day basis, like just even from UV rays.
Yeah.
Which is, reversing damage is a big deal. I mean, at the end of the day, if you can in 24 hours reverse the damage you sustain from the sun, let's say on one day when you spend too much time outside, that's repair work. That's actually easier repair work than waiting for the damage to accumulate and trying to reverse it down the road.
Absolutely. The way I see skin aging is basically a two-pronged sword, right? So you have what I call as intrinsic aging. So that's basically your whole cellular machinery at the skin level kind of declining. So your mitochondria are declining, your collagen sort of that in the skin that keeps the skin tight is declining. And then there's extrinsic aging. We're all going out in the sun. We all have the pollution of the cities we are living in. We're all being exposed to secondhand smoke, et cetera, things like this. And that is really accelerating the skin aging process. So you do have things like retinol out there. So a lot of people use retinol-based creams to sort of tackle this intrinsic aging, but you can't put retinol and go to the beach, So what we did was two separate kind of trials, one looking at more long-term the effects on wrinkles, and second, as you mentioned, what if we uh, induce sort of a redness, sunburn damage on the skin, and immediately applied a cream with Mitopure on the back. And in the end, it's really doing what we have seen before on the oral side. It's improving mitochondrial health and it's lowering inflammation. And these are the two biggest attributes of this molecule.
Yeah, no, and the idea. So obviously, the urolithin A molecule is it can be absorbed transdermally into the cells, which is the other big question, right? Is like
Mhm.
and I think what's interesting also what you said earlier, you obviously you could get benefit from taking it orally, but I think that the body has a hierarchy of needs that it's going to fulfill. And the skin is not at the top. It's not going to beat, do I need more energy in my muscle? Do I need more energy in my heart or my brain? Those guys are going to outrank, do I have skin wrinkles or is my skin showing up with sun damage? So, it's this really interesting idea of going at it from the outside and then the inside is,
Mhm.
stacking the two is pretty magical. And you had said also that people can see some visible results after as little as a couple of months.
Yeah, so we did a time course study with participants who are putting either placebo cream or a mitopure cream over time, 2, 4, 8 weeks. We start seeing effects almost. Mitophagy is a very quick process, so in about a couple of weeks, you start seeing impacts at a certain level on improving skin health. And then if you're looking long term, 8 weeks, people, and there's very sophisticated ways to look at like wrinkle formation. So we have all this photo instrumentation taking pictures of the participants, and we can really see about a 15% reduction in wrinkles. For example, skin is better hydrated, skin barrier, which we always look at as call as the skin elasticity. So yeah, happening in sort of the 4 8 week time frame.
That's amazing. That's pretty fast. I mean, we were talking, you said, yeah, well, it takes a while. And I'm thinking you were going to say 6 months. I'm thinking 4 to 8 weeks is a pretty 4 to 8 weeks is a pretty reasonable window to start seeing some benefits.
Yeah, I mean, if you look at the whole skin space, a lot of people get fillers to immediately want to sort of get the immediate, wrinkle lowering, or they use retinol, which is about 2 to 3 months or 6 months to see effects. I think here you have a very safe, natural solution compared to retinol, which also works at countering extrinsic aging. So in my mind, that's sort of where we are positioning this as.
Yeah, no, big win. Big win. Okay, so as we wind down, our last topic of the day, there's whenever a molecule like urolithin A hits the market and is showing so many benefits, we now start to all of a sudden, certainly in my communities, I get people going, "Oh wow, look, I just found like a huge bag of urolithin A for $10. Why would I spend all this money on timeline?" And I'm just sitting there going, well, I'm going to ask you, where are you finding your $10 urolithin? And so the copycats start to come out of the woodwork.
Yeah.
And so I just thought we might bring that up a little bit because it's an issue in the industry with almost any molecule, right?
Sure.
And trying to understand what you're actually getting and is it actually going to be safe and efficacious is I think it's a big issue. So, I mean, there's the issue of supporting the companies that are doing the research, making the investment, doing all the work, but at the same time, what are you truly getting? So, I don't know if if you guys have looked at all at some of these other cheaper alternatives that seem to be popping up like mushrooms.
Sure. No, I mean, you're bringing a very important point for the whole industry. As a company that has put 15 years of research behind before believing that the data exists to go ahead and launch the products that would benefit a lot of people. And once the uptake in the market, a lot of these Me Too companies that see, oh, this is becoming a hot molecule. Let's make our own version and source it from who knows where, maybe in China or other places, and start selling it a bit lower cost. I think the issue there with is a there is no GMP sort of good manufacturing practices being followed. We rely and we work with the best American and European sort of groups in the world that have almost sort of the highest quality of GMP in manufacturing units for example, an FDA would audit very regularly. And then we have gone and done the hard yard of taking the urolithin A that is manufactured here through safety and toxicology, and really looking to make sure it's 99.99% pure and has no impurities, etc. And that's the one version we have gone and got a designation that in the US we call as GRAS on. So that's the designation of generally regarded as safe molecule that allows us to put it in food and dietary supplements. Now you have these companies that are obviously don't have a GRAS urolithin A. They are obviously not characterizing urolithin A purity or the impurities very well, and it's basically not clinically tested as well for safety and efficacy. And so what we have done and what we are doing is basically trying to order some of these different suppliers, and we know other groups in academia that are looking at the whole industry, just not urolithin A, but you mentioned spermidine or NAD boosters. And basically, there's a lot of, honestly, I don't like to use the word, but it's really crap. The purity of that they're claiming is 98, 99%. Turns out it's even 40%. So people think they're getting something probably $20 cheaper, but they're also getting something very impure and that is very poorly characterized for quality.
Right. And so, in a best case scenario, it doesn't work. In a worst case scenario, you don't know what you're using. So it's tricky. And, as we were talking about with spermidine, even the issue of the molecule of the synthetic spermidine being only 2-dimensional versus the food grade molecule, which is 3-dimensional, and not having any research at all on how that 2D molecule acts on humans. And then you get the double whammy of now these guys saying, look, this is super cheap. We're going to give you 10 milligrams instead of the 2 milligrams that you're getting from the other guys. And so now you're like 5 times the dose with something that you don't actually know what it's doing. You're rolling the dice. Anyway, I just think I think it's an interesting discussion, this whole discussion of copycats, because it's going to happen, but it really then falls back on the individual, and even in some ways, as you said, the industry, to take a look at this stuff and say, what are people really getting? So, anyway, I'm a huge fan of your products. As you know, I can't decide what my favorite is. There's the whey protein shake, which is like my favorite whey protein shake. There's the ginger powder, which I think is like, I put that in yogurt. It's the best. Then there's the berry powder. And then when I'm traveling, I'm popping the capsules. So it's, you've really done the work to make it as accessible to people as possible, no matter what their situation is.
Yeah. I mean, good science should be accessible and should really fit in different aspects of your daily life, right? So that's has been just not launch a pill because 60% of the population likes to pop pills, but provide you with in the morning when you wake up, if you like taking smoothies and shakes, you can blend your morning dose with that kind of a format and mix and match if you want to.
Yeah, no, I love it. It's fantastic. Okay, so where can people find you? Sure. Where can they learn more? There's great stuff on your website. So
I invite your audience to take a look at timelinenutrition.com. That's where a lot of our products and the science and the studies that have gone behind it are there. But also, if they want to go and learn more on the actual science and research, they can go to mitopure.com, and that's where we have a lot of background on all the research, and if they want to understand how the molecule works, they can access that website.
Amazing. And I believe that you've generously offered a code for the audience of NAT10, and that will save them a little bit of money on any order that they place. So, sure. Dr. Singh, thank you so much for your time today again. This has been a great conversation. I can't wait till the next one when you get your next batch of research. But this, in the meantime, is super exciting and a beautiful evolution in just a year of information.
Yeah, always a pleasure to be on your podcast, Nat. Pleasure. Happy to be back next year.
Thank you so much.